Welcome to the Mindset Game podcast. I'm Vered Kogan, and I'm thrilled to have Dr. Craig Weiner with us on the podcast again. Craig is a doctor of chiropractic and certified Meta Health Foundations trainer. He is the co-director of the EFT Tapping Training Institute, along with his partner and wife, Alina Frank. And he is a certified and accredited master trainer of trainers for EFT International. He currently serves as the chair of the board of trustees for EFT International. And for those of you who are not yet familiar with EFT, it stands for Emotional Freedom Techniques and is referred to as tapping or psychological acupressure. And it's used as a treatment for physical pain and emotional distress. Craig is also an approved Matrix Reimprinting trainer for the EFT Matrix Reimprinting Academy. In fact, Craig was my amazing trainer when I got certified in Matrix Reimprinting. And he was also my incredible mentor throughout the EFT tapping certification process. And I recently got trained by Craig on Meta Health Foundations. And so I invited him back on the show so that you can all be even more informed on the mind-body connection and feel more empowered when it comes to your own health. And so, Craig, it is such a incredible delight to have you back on the show. Thank you so much.
You're welcome. Thank you for the invitation. I'm happy to be here and spend some time with you. It's always fun and the time flies by.
It does. So for this conversation, I'd love for our focus to be on the mind-body connection and what we call meta health. So how about we start with what is meta health?
Yeah. So I love that blend because they're so overlapping. And what I would say is a meta health approach by name, it's a trademark. I'm a trainer for Meta Health International. And what it really is a way of viewing the idea that who we are in our health and wellness, physical and psychological as well, often has origins in psycho-emotional roots and experiences and lived experiences that show up in the mind and body that we will call signs and symptoms and diagnoses and conditions, right? That there's a connection between those. And it's a method, it's really a methodological approach for exploring emotional root factors that are involved with why we develop what we develop, why certain factors could influence us to have different conditions happen to us. When I first started exploring this, I come from 30 plus years as a chiropractor, right? And so I've been in, that's still complementary health, but it's still pretty mainstream health, at least here in the US. And what I'm very mindful of is that when people start to look at the mind-body connection, sometimes what happens is that people start to look, well, if my mind affects my body and my thoughts show up in my body, and we look through that lens, then it's my fault that anything happened to my body, that I'm fully responsible for whatever I got. I'm responsible for my cancer. I'm responsible. And I don't think that's healthy or helpful at all, looking at it through that nuanced or not so nuanced lens. So I was very conscious when I started to enter this body of work that what I would never do or never want anybody to feel is that it's their fault that they developed a condition. Why we develop what we develop is a multi-aspected, that's not a word, has many different factors to why we have what we have, especially in our bodies. So that's the first thing that I want to say. However, what I also found in my many years in the health field is that when we look at the question of why me, why now, that if we ask it why me, why now, that's not usually helpful. It always stresses us more. But if I can bring in a level of curiosity, it's I wonder why. I'm curious, why me? Why did this happen to me and nobody else in my family? Why did it happen now at this particular time when all this is happening in my life? That if we can bring in a lens of curiosity, that can lead often to awareness and self-awareness. And that self-awareness can start to lead towards self-compassion. And self-compassion and insight and mindful awareness can often lead us to understanding. And understanding can lead us to making sense and meaning of why what's happening for me. And that can be a very powerful part of our healing journey and overcoming and understanding why that can lead toward resolution or healing happens. So for me, that intention is really an important part of the process beyond the techniques and specific meanings and all of that. I also, I'll call it the Louise Hay methodology, for lack of a better word. And nothing against Louise, brilliant, amazing woman, big advocate of EFT, by the way. But what's happened, when I say that, is people want to say very often, it's like, okay, what's the meaning for this? I've got rotator cuff syndrome. Let me look it up in a book and see what that means. I've got a left torn meniscus. What does that mean? I've got arthritis in my spine. What is that? So I'm also really conscious that while there may be patterns, and I do believe that there are, and there are possibilities that are more likely, given different things that happen within us that could have metaphorical meaning and perspective, that I'm also really careful to not assign that to any one person and this, therefore that. I've got this and this is what it means for me. And you've got that and this is what you should look at. So I was also very conscious going into this work that while I was looking for deeper insight where I could accelerate my understanding and inquiry with somebody for what something might be meaning for them, to be very careful to not assign a meaning to another person either. Now, I don't know if any of that answered your question of what's meta health, so I'll kind of come back to that. That was a ramble, but I'll return to your question. So meta health is a kind of inquiry that explores the emotional contributing factors and even potential emotional roots on a psycho-emotional level of lived experience and where patterns may have started to set up in the body that then may have increased the likelihood of epigenetic expression of a condition, of stress related to that brought a condition to the surface. And so the interesting thing is when we look through that lens, anybody can use it for themselves on certain levels. And it's also techniques and approaches that's a deep dive of learning that any healthcare practitioner can use to explore, if they're interested in exploring with a patient or a client, what those emotional root or contributing factors might be in a way that can be helpful, or it can at least refer them or assist them in, okay, now that we discovered that connection, now what do I do with that? And so it can be used through many different lenses, whether you're a nutritionist or an EFT practitioner or a medical doctor or therapist or whatever. So that's a start.
It's an excellent start. And so just to give people a little bit more examples, what might be an example of an emotional contributing factor that may be connected to a physical station or disorder?
Okay. So for example, I guess we'll start gently. If we look to, so many people in the US have conditions related to their digestive system. Okay, we'll just start there. And that could be from esophageal reflux to ulcers to IBS to, all kinds of different things that can go wrong, that we have clear names for the diagnoses of the condition. And I should right now also be really conscious to say, in a form of a disclaimer, is anything that I say is educational in nature. It is to be explorative and questioning. Please don't make any decisions on your health based on anything I say right now without consulting your physician or your specialist if that's something that you're suffering from. And from that lens also, it's really important that when we work with meta health, that actually having a diagnosis to actually know where and what the problem is really helpful and an important starting place. So that I want to say clearly from the beginning. And we all need to take responsibility for any steps that we make with regard to our health and listen to our bodies. Is this working? Is this helping? Does this make sense? Does this feel intuitively congruent with my knowing of my body, which is really important. I want to take it a step back for a second to just speak to the wisdom of our bodies. I want to start there. That when I look through a mental health lens at anything I might be experiencing or a client might be, an important part of the mental health perspective is that what's happening is not a mistake. That's what's happening is not, even though we might feel that or experience it or feel that way, is not our bodies attacking us. But through a mental health lens, our body is always trying to accomplish something in order to help us survive. Our biological imperative is to reproduce and to survive, to keep the species going. So when we look through this lens, is how, and the inquiry is, how might this be trying to solve a deeper problem? Whether I'm having, burning pain when I swallow, whether I can't go to the bathroom, whether I'm going to the bathroom too much or too little, whatever it is, that rather than this thing happening to me, that there's real power in going, how might this be my body trying to assist me through something? How might this be my body trying to show me something, teach me something, point out something to me, make me aware of something that I'm not acting as if I'm aware of? And so from my chiropractic lens, it's interesting how they really dovetailed. At the core philosophical foundation of chiropractic since the late 1800s was the idea, and the philosophy, the hypothesis, that the body has an innate wisdom, that the body has an innate capacity to heal and is always working towards that. I know that may not always feel that way, and I know it may not always be our experience, but if we buy that idea, then whatever is happening to me, there's a purpose for. Okay. What I also find interesting is that often in our language, we speak to some of those kind of core emotional aspects to what's happening in our languaging without even necessarily being aware of it. When I am often talking to a client and they're describing their condition, and they say, something like I just can't take this anymore. I am not going to swallow this without standing up and saying something. I am just not going to go ahead. There's metaphor that often will come out that's like, I can't take this in. I can't digest it. I really need to chew on this because it's really not sitting well with me. And so often in our languaging, things with digestion will come out speaking metaphorically in ways that we didn't even realize we were saying, but they are powerful and meaningful because there is a relationship there. So that's always intriguing to me, whether you're an EFT practitioner or whatever, or just listening and observing yourself. The languaging that we use describing something that's happening in our bodies can be a powerful insight to what might be happening on a deeper psycho-emotional level about how we're thinking and feeling about ourselves that might be involved with what we're experiencing physically. So from a meta health lens, when we start to look to systems in the body that have to do with digestion, it's often around conflicts in our lives that are happening or or a theme that's being re-triggered in our lives. That's something about, I'm conflicted and I just don't want to let that in. I just can't accept that. I just can't take that in and be okay with that. I can't digest it and swallow that and be able to work with that and take that in. I refuse, right? So there's often a conflict around something in one's life that has to do with that. And when it comes down to the bottom half of our digestive system, it's often something around not being able to let go of something that's too meaningful or important that I'm just not willing to let go of and release. And often there are themes. Now, what are they can vary as much as the person. It could have to do with their personal relationships or their family or their work or financial, or any number of things. So we often say in digestive related issues, there are chunk themes, and we say, like, all right, what do you mean by a chunk? It's like, okay, well, when we eat, we're taking in a chunk of food, but in our lives, we're taking in chunks of information and chunks of different things that we're learning. So it's like, like a widget or a bite or a chunk of something, right? That we're either not wanting to let in, not wanting to accept, not wanting to integrate into ourselves, or not wanting to get rid of. Because that really is the function of the digestive system. Excuse me. And there was something I was going to say that I thought of in the middle, and I'm like, oh, I'll remember that. Let me see if I can grab that. Nope, I'll let it go. Oh, okay, there it is. See, isn't that amazing? Like the moment I say let it go, it's like, boom, there it is. Okay, I want to talk about what I mean by conflict. So this is where I want to talk about when things go wrong. And even that is kind of a funny way to put it. When we have challenging things that happen in our lives, sometimes in certain worlds we call it an SEE, a significant emotional event. Sometimes we call it a traumatic moment. So there are different ways to describe significant, unique moments in our life in which something happened that didn't fit the flow of the way things were supposed to happen, had probably usually a significant emotional response for us, and often leads in those adverse moments to decisions that we make about ourselves or the world or the way things are. And through an EFT lens, we often call those, what are the significant limiting beliefs or core beliefs that we create? And you know this well, we often, whether it's EFT or Matrix Reimprinting or so many other trauma modalities, we are looking for those key learning moments, those key decision moments in our life in which we made important decisions about the way things are, the way we perceive them to be, that then determine so much of the rest of our lives. I think people understand that. Something happened to me when I was young and I made the decision that you can't trust people. Something else maybe happened to my life that informed me, and the decision I made is that I'm not worthy of being loved. Or that I'm not good enough, or that the world isn't safe, or any number of unique core beliefs that get created, especially when we're very young. And it often takes significant, I don't want to say significant repair, something transformative that can shake a root that has become a really deep, strong, powerful root in our lives, which has branches and other roots off it. Knowing that, well, that's not really true isn't enough to usually change it, right? That somehow we bring some sort of witnessing and transformative experience to go, you know what, that really isn't true and I don't believe it anymore. I'd like to say it's easy, and sometimes it is, but often it's not. And it takes work and our personal work and journey, whatever technique you're using. So what happens in often these traumatic moments are certain qualities that we refer to as Uden moments. In our field, we use the acronym UDIN, and it just describes a moment, kind of a shock traumatic moment in which something happened that was unexpected, something happened that was quite dramatic, often emotionally intense in that moment, that in that moment I felt really isolated and alone and without help. And is not being resourced, not having the resources to successfully overcome that moment. I wasn't able to fight or flee, and often I just freeze because I wasn't strong enough, fast enough, old enough, big enough, confident enough to do something about it, and I just shut down. It was often a common response and went into a freeze. So we have these moments in our life that set down an important neurological network that underlie how we think about ourselves in the world and how we act and how we behave and the choices we make and the behaviors we adopt to protect and keep intact, and these adaptive behaviors and adaptive choices that we make based on often these traumatic moments early in life. I'm being a very bad guest here because I'm not pausing to let you add anything, but I'll finish this last train of thought and then.
You're awesome.
So, what is a common pattern is that we have these original traumatic moments. And then, despite our attempts, we often have repetition of that theme throughout our lives. Freud used to call it the compulsion to repeat the trauma. Somebody grew up with an alcoholic parent, and maybe let's just say their dad drank, and we won't even say there was physical abuse there. We'll just say that it was challenging as a child to live with that, because it can be. And of course, the decision is, I'll never do that. One decision could be one or the other. I'll never do that. I'll never have anybody in my family like that. And they end up having one relationship after another with somebody that ends up having a problem drinking, despite them deciding not to, because it's almost like these patterns repeat themselves over and over, and somehow we're called to them on an unconscious level to try to heal them. Sometimes we don't, and sometimes we do. But either way, when we have these original traumatic moments, it creates this neural networking that then makes us often hypervigilant and hyper aware and hypersensitive to moments that feel like, taste like, smell like, look like, seem like those early traumas. And when we do, we have a part of ourselves that subconsciously automatically starts to go, oh crap, not safe, not okay, this doesn't feel good, got the heebie-jeebies, okay. And these triggers happen for us all the time, and we have different behaviors. We then either go numb ourselves with something, we get the heck out of there, we never put ourselves in that situation if we can. So we have all these either avoidance or rushing to behaviors in different ways that we learn to try to adapt to that. At any rate, the reason that I'm sharing that is that when we have these original traumatic experiences that then set in these patterns about how we behave and how we think and how we feel, you can't separate that from how your body responds. Right? It's not like, well, I'm only going to have thoughts about it, but it's not going to affect my body. How is that possible? How is it possible to be thinking about stressful things, but then not be producing adrenaline and cortisol? How is it possible to feel like I really want or need this thing to make me feel better, but it not trigger the rewards pathway in my brain and body for a substance or an activity, etc.? So the idea that somehow you can separate these thoughts and beliefs from your physiology is silly. And if we are overusing or underusing parts of our body, and we are flooding a part of our body with cortisol, or we're flooding our body with other different hormones, etc., that has an effect on tissues over time, and on our cells, and on our organs. And so we can start to look at that increase, like, okay, why is this stress affecting this organ, or why is it affecting this organ? But the idea that somehow our thoughts and feelings and emotions and beliefs and decisions and behaviors can't show up in the body or aren't related, I think that's kind of short-sighted. So that's a good place to pause and give you a chance for a reflection or question or any other direction you want to go in.
Thank you, Craig. This was so helpful, because I think that many of the listeners can think back to significant emotional events that they've experienced in their life.
Mm-hmm.
And, positive or not so positive, right? Negative, what we would call negative experiences.
Mm-hmm.
And I love that you made the distinction between kind of our thoughts about that, right? Like, I'll never do it again. And then the unconscious aspect of it, which may be that because of these Udin moments, right? As you said, UDIN, unexpected, something that was distressing, we felt isolated and we didn't have the resources, no resources, that, in those moments we formed certain patterns that then, impact our body. So in other words, what I'm hearing is really the trauma in those cases is in the body, and that there are parts of us that are responding to that through manifestations in the body to get our attention so that we could do something about it, perhaps release something that is no longer useful to us, a thought, an emotion, something like that, and take even better care of ourselves. And so what is coming up for you kind of as I reflect that back? What do you think is really important for our listeners to know, not only about how to heal if they are experiencing something in their life, but also how to prevent things from showing up in the body?
Two interesting but different questions that connect. Okay. I think what I want to say first is tying back to where I started. So, for example, over there is actually part of my chiropractic office, right? Out of view here. Right? So, during daytime, on weekdays, I'm a chiropractor, and we'll use that as an example. A patient comes in with neck pain. I ask and I inquire, and they will give me their reason for why they think they have neck pain. I'm like, okay. I ask, what do you got? Describe it to me. Tell me your experience of that. And they describe whatever their adjectives of their this. I've had it this long. It started, right? So they're going to have their history about it. I take that into account. Of course I do. But I'm also looking through a meta lens at what else might there be. Now, when I have my chiropractic hat on, they're not necessarily saying, Dr. Craig, can you tell me what you think is the emotional root cause of da-da-da? I can't think of one patient that does that all the time, but most of them don't. And they just want the pain to go away. So, I'm listening to what they're saying. I'm listening between the lines, and I'm asking questions. It's like, what do you think? Oh, I just woke up with it. I mean, that's the number one cause of things in my field, is I woke up with it. I don't know. Nothing happened. I just woke up with it. I don't know. Maybe. I'm like, yeah, boy. There is like an epidemic of bad night's sleep that lead to a host of all kinds of conditions. Or the real answer is, I don't know. Right? And, years early in my practice, I used to be like, well, guess there really wasn't any cause. We don't know. Let's just move forward with treating it. And now I have a slightly different lens because I kind of want to know. And, my experience is that there are other factors at play here. And if that person becomes more aware of it, might they choose to take some different action steps other than just doing their neck exercises, which of course I will offer as well. So I ask, I'm just curious, how long's this been going on? Yeah, a week, whatever. Okay. So I'm curious, you said you didn't do anything. You weren't in an accident. You didn't and you didn't overlift. And, they're not coming up with some physical etiology or cause for it. And I'm just curious, what might have been what's either going on or has been going on or was going on before this came on that's particularly stressful in your life right now? Is there anything that you're struggling with or really challenging with that, might not seem like it has any connection to your neck? Now, this is where a meta health lens can assist me. I have ideas and thoughts from a meta health lens what that could be about, but I'm also careful not to just jump in and like, does it have to do with it? So I listen first because I'd rather it be organic. And they're like, well, there's been a lot of stress at work. I'm like, that's one answer. I'm like what? And it's like, I've been working really hard to get this position. And then this other person at work ended up getting the position that I got. And so that's been really stressful because I was counting on the extra income and I thought I was going to have that position. And it wasn't fair. I have 10 times more experience and more years. So I'm like listening to this, and that lines up for me from a meta health lens that often pain in the neck has to do with unfairness or injustice. Okay. That's the thing. Now, I didn't say that to them, but I'm like, that makes total sense. So from an emotional root triggering perspective, that is directly relevant to what they're. Now, I'm still going to treat them physically. I'm still doing massage and stretches and adjusting their, all those things that I do physically. But it also allows me to have a conversation about, not that all of a sudden I put my EFT tapping head on because they didn't come to me for that. but it might allow me a discussion of what are some things they could do about that, how they're feeling about that, what are some supportive steps that they could take with this, how are they working with that? If I can also start to work with the lens of, and they say that, it's like, okay, so I'm just kind of curious, given the neck pain, and I always put it on myself first. So I say, when I have something happen in my body, this is what I do. You're welcome to try it or not try it. I always try to think, rather than it just being a pain in the butt and a pain in the neck and a pain for that, it is that too. But if my body was trying to show me something, teach something, point me out, trying to help me in some way that I might not be aware of, how might this be doing that for you, do you think, if you had a guess? And they're like, well, I'm making it up right now, but the truth is that I really wanted, I actually needed the funds, I needed that raise, but they really don't respect me at this job anyway, and this just kind of proves it, and this really validates that. So I'm starting to really think about actually a change of companies right now, given that this happened. And before I probably just thought that would be too hard or too stressful to the family, but I'm realizing it's really, being treated fairly is like really important to me, and they don't do that here, this company. So it might lead to that kind of a conversation. And I know that also from a meta health lens is that when we start having those kinds of cognitive shifts, when we start having those awarenesses about what really might be underneath this, not saying it's not real physically, because it is, there's still inflammation and there's still all of that happening. But that's often a key in starting to move things forward and progressing through the healing journey, and accelerates the process. So that's kind of how I, in my chiropractic, how I use it. And you had a two-part question. So I guess the first part, these are like the longest answers I've ever given. Usually I'm really good with short answers, but not today.
Awesome. Thank you, Craig.
It's okay. I forgive myself, but it takes some, I think it's helpful. So I think the first part is going back to the beginning, is getting curious. Okay, I hate this, I don't like it, but I've never found somebody heal faster when they're feeling pissed off at their body. I've never find it accelerate their healing journey. Like somehow there's them and there's my body and it's killing me and I hate it and I wish I could just chop it off. And like that adversarial relationship never heals relationships with other people, and I've never seen it be helpful in healing personal. So the first step is, how do I start to have a collaborative relationship with my body? It's like, okay, I don't like this, pisses me off, it's the worst timing in the world as far as, I don't need, and that's where EFT can come in, right? How do I neutralize that? It's like, even though I'm so pissed off right now, because I have this golf tournament next week, and my back's killing me, and this is the worst timing, even though I'm really angry about that, I can still accept myself, even though I feel really pissed off at my back, right? So in other words, how can I start to create a healing, collaborative relationship with my body? Because what if it was trying to help me in a bigger way that I'm aware of, that I need to become aware of, and then I can have a very different relationship. So being curious, listening to one's languaging about how one describes it, maybe through speaking about it or journaling about it, and noticing some of the languaging. Metaphor, again, is so powerful. I will hear somebody say, oh my God, I've got this huge just pain in my ass. It's like they're just, it's like hurting and right there. And, sometimes I'll just say, is there somebody right now that's a pain in your ass? And they're like, how did you know that? I'm like, because you just said it. But I don't say it that way, of course. But like, I'm listening for things that they're not listening to. So getting curious about, I guess I'm speaking to the person that's listening to the podcast that isn't necessarily a practitioner. They're looking at it for their own health and healing. Listen to your words that you describe what you're going through physically. And that can often provide some insights and clues to what might be contributing. Because, we have those original traumas, etc. But then we have instances in our life that bring up the same feelings of injustice or unfairness, or somebody that's after me, and, or whatever it is little triggers start the program over again. So like we have this original program that develops at the beginning with those original young, often traumatic moments. And so we have these special biological programs that get kicked off that connect the feeling of being isolated or abandoned with this, how it feels in my body, etc. And so a connection develops. And then each time I feel that in my life, it's like, okay, it kicks the program off again. It kicks the program off again. And at some point, enough of those physiological changes being stirred up by our neuroendocrine system start to result in tissue changes that result in symptoms or changes in our body, right? Doesn't happen. We don't necessarily experience all the things that are happening in my body. You know, I can be stressing out my adrenals and it doesn't necessarily, you know, all I experience is like a heightened sense of awareness or stress or movement, but eventually it starts to cause burnout and it starts to cause maybe chronic fatigue and it starts to cause other things that result with the tissues and organs starting to change because it's been exposed to that stress over long periods of time. I mean, okay. Fine. Yeah, I have another note that I'll make sure to bring up, but go ahead. Another question or whatever. Where would you?
I really appreciate the mindset here around the wisdom of the body and accepting the wisdom of our body and being curious as to what it might be wanting to get our attention toward. Maybe, as you said in the example, maybe we're being guided in some way to transition into another job, relationship. Maybe there's something else that we need to be aware of. And I remember a conversation I had with a very good friend of mine who's a palliative care physician. And she was speaking about how people that had, for example, cancer, and they're all about, you know, I'm going to beat this thing. And, you know, this kind of very combative language toward their body. And she was curious about that, you know, how that is potentially not helping them to heal. And so I wonder if you can kind of speak to even a little bit more as to that mindset shift from the, you know, this is something that's being done to me. It's a bad thing, you know, that my body's doing, to a shift of like, I wonder what might be at the heart of this, what my body is trying to tell me, because we do know, as you said, that the body can in fact heal itself. You know, of course, placebo effect, you know, and so on, that people are well aware of. What do you think is really important in order for people to embrace more curiosity and acceptance as to their body and what their body might be trying to tell them?
Yeah. I think I first want to honor, you know, those people that might be thinking, yeah, but you haven't lived with this for 30 years, Craig. You don't get it. So I mean, that can be anything from an advanced neurological condition to cancer to, I mean, so I just want to pause and reflect. I can't personally know that experience that I haven't experienced. I can have compassion for it. I can acknowledge the difficulty with even exploring what we're talking about. So I just want to say I don't consider that without its challenges. So I want to acknowledge that. The analogy I will often give for most people that will relate to is like, if your child was having this condition right now, do you have a child in your life or a niece or nephew? And it's like, yeah, okay, if they had this pain and they're da-da-da-da and they were going through this right now, would you be like, buck up, move on, come on, this isn't going to last forever? I mean, would you treat them with an energy of anger or irritation or frustration? And do you think that that would help them get better quicker? Majority of the time, people are going to say no. And so when we look to, you know, maybe the languaging that, what if that part of you was suffering from this? What if it was a small child? How might you treat or speak to that or engage with it? How would you be? Would it be easier to bring a loving, supportive energy to it than what you have right now? And how might we explore that? You know, so that often works for a lot of people. It's just, you know, you have this beautiful, innocent little child that you want to treat in a loving, compassionate, caring, gentle way. If we could look at that part of our body that's dealing with that in that same way, that can assist many with starting to move in that direction. So that's one part. And when I start to have a conversation with another way that I use that languaging is I use what's called parts languaging, right? And I know you know what I mean, but so often when I think about something happening, when I think about, this condition that's, the skin that's flaking, or I have whatever it is that I'm having in my body, that's like me. What if we had a conversation with it like it was a part that I could actually kind of separate and talk to? It's like, okay, skin, dude, why are you doing this to me? I don't need this right now. I can't go outside. It's embarrassing, and whatever it is. And what if we could have a dialogue with it? That's another approach. Using tapping or anything else is like, okay, why me? Why now? What are you experiencing? What are you feeling? And if I can move actually into an open conversation and that idea, Bessel van der Kolk's book is The Body Keeps the Score is only from a negative, but the body also keeps positive things as well, and negative things it just remembers, however we want to say it remembers, but that's still a great question. But at any rate, the body, if we trust that the body has this internal movement toward surviving and healing, because it always is. I mean, we're not doing it consciously. I cut myself, my body starts, setting down thrombin and setting down scar tissue, right? I mean, all these things are automatic mechanisms that attempt to move toward healing unless something's in the way of that. That what if I had a conversation with that body part and said, what, like, help me to understand, what are you feeling? What do you need from me right now? Kind of like that same energy from a kid. Maybe they're a teen. It's like, all right, I don't know why you're acting this way. I really don't, but I'm in a place now that we can have a conversation and say, what do you need from me here? Like, how can I help? I think of that more as an adolescent than like a little. So whatever attitude works for you to start to engage in a way that actually becomes a recipient of information as opposed to just a teller of information. I feel like I'm going to stop and pause. I don't care whether you want to talk about it as a meditation, as a conversation, as a silent inquiry, as a taking it into your dream time, as in a journaling, as in like we all have our own internal pathways of listening. And so even in meta health, there are different exercises of just breathing into that body part that's giving us a problem and starting to open up to receiving information from it. And I often hear something from my patients going, God, it felt like, what took you so long? Like I'm talking to you and screaming at you, but you won't ever like listen to me. Finally, you take a moment to like hear what I have to say. And that comes in different ways for everybody. But that's often a big piece when they're not just right and they're not just in charge, but they actually kind of honor and listen and receive information from that area of our body. I had made a note before, and I know it wasn't with your question, but when we talk about the mind body, there is a huge, huge, huge source of data from the what we call the ACEs studies, the Adverse Childhood Experiences Study, which we talked about last time and we didn't, I don't recall right now, but document the very, very strong correlation between early childhood trauma and more physical diseases, diagnoses than you can name, and behaviors, from addiction behaviors to things like heart disease, liver disease, longevity, alcoholism. I mean, so many different physical conditions and behaviors that are well documented that, it's to the point that when somebody comes in with a physical diagnosis, if you don't consider at original cause that there may have been early childhood extreme adversity, et cetera, that set up that pattern, then you're kind of just not addressing what may very have a strong correlation. Not saying everybody does or every doctor does that, but more and more that has grown in understanding the correlation between those things. So prevention was the second half of your question that I'll wrap around to. I guess I'll just look personally. So ideally, and I'm not perfect with it either, and I will be the first one to admit that, but when something starts to show up physically for me, I still have a response of, or maybe just if I ignore it, it'll go away. I mean, I have completely human responses too. But I try to not have too long get to. It's like, okay, fine, fine. What might this be about? What's going on in my life that this might be occurring to help show me, teach me, point me, remind me of something so that I can course correct that way. You know, other than that, I guess like in the EFT world, we talk about doing our personal peace procedure. There is, that commitment to always doing our personal work, but not every, and to varying degrees and intensities. I don't want to say you have to stay in therapy your whole life. That's not what I'm saying at all. But, I think that part of the human experience of staying healthy is an inquiry of what are those patterns that don't serve me anymore, even if they're not a disease or diagnosis. But the things where I put things off and I never attend to them, the ideas that I don't deserve X, Y, and Z that show up in my life in different situations because I didn't ask for what I needed. And to me, the life circumstances are just kind of the data points on the screen that show up, but there's a lot happening behind the screen that we don't see, on our computer or otherwise. So I guess it's just to what degree our own personal commitment is to our healing journey. I don't have any judgment that anybody should always be doing that, but I think that living a life mindfully and with self-awareness and introspection, and then when we hit bumps or challenges, that we look at what that might be about and we do the level of work that we're ready to do on that, is a useful way to live. But we all do that to the degree that we do or don't, and that's okay too. It's our own journey. Yeah, I'm not sure what else I want to say about that.
Well, I appreciate that you gave us some ways to do that, in our conversation today. So, for example, if I'm experiencing something, some physical sensation in my body, be it pressure, some skin condition, whatever it might be, to breathe into that area, just pause for a few moments and just mindfully pay attention, give our attention and intention to that part of our body with curiosity, breathe into it, and just notice what might be showing up. What are some thoughts? What are some maybe memories? What if anything, may show up for us, and to take action on that too, I think is really important. So if, let's say,
take a healing step, take one small healing, that's what I'll offer. What would be one small step you could take with regard to what's on, not just with regard to the knee pain, right? In other words, yeah, you need to do your exercise. So I often try to include that, like beyond doing your exercises and avoiding doing your squats, it's too much, right? I mean, there are physical things that aggravate, but what might be one small step that could assist you in moving forward with that thing that you're feeling conflicted about moving forward with? What's one thing that could stabilize some things that are unstable in your life right now? What's one small step that you could take? And, through a coaching lens, all of these things are, what are small steps that somebody can take successfully that isn't too far out of reach, that they can then start to experience with that association issue some degree of success, some degree of achievement, some degree of forward progress, which elicits its own hormones and neurotransmitters, etc., as we start feeling more successful and having more power over something or success over something that has healing properties as well. So yeah, that's right on.
And it just reminds us of how important it is to be mindful of the emotions that we experience throughout the day. And if we're experiencing some form of stress, to just pause and take a breath and do what we need to do to take better care of ourselves, so that we, from a prevention perspective, so that we don't create certain programs that then manifest in the body later on, as you said, potentially to be able to do that prevention work. And so, Craig, I'm so grateful to you for giving us this really good kind of overview of the mind-body connection, of how empowered we can be for ourselves, and also if we're some kind of a health practitioner or coach, just to invite some curiosity, as to what might, be not necessarily causing, but correlated with something that's going on, and so that we can, as you said, course correct and feel better. How can people learn more about the EFT Tapping Training Institute, of
Yeah,
course, more about meta health?
sure. I mean, I run Meta Health, 2-day trainings about twice a year. I also consult with people, but the best way to find out about any of our trainings is just the EFTTappingTraining.com. And if you want to email me a question, it's Craig@EFTTappingTraining.com. And that's always the best way to just find out more, whether it's a training or insight or articles or interviews or whatever. Yeah. And this was a great start. Thank you so much for the time today. I appreciate it.
Oh, thank you. I'm so grateful. And, one of the things that I personally took away is really also the importance of self-compassion throughout this whole process, no matter what is going on. Have compassion for others that may be suffering from something, curiosity and compassion as part of the healing journey. And so, once again, thank you so much, Craig.
Yeah, you're very welcome.